The premium version of the Veta 5 comes with a side stream capnograph, but you may have a side stream capnograph integrated into your monitor. Either way, a side stream capnograph is coming with a water trap that is attached to the capnograph itself and the sampling line, a gas sampling line. One end of the sampling line is attached to the water trap, and the other end should be attached to the airways at the nose of the patient, of the intubated patient. It could be attached directly to the Y-piece, if you have such a Y-piece with an attachment port, or commonly into an airway adapter which has a sampling port, and this is attached to the Y-piece, and then it's attached to an endotracheal tube. Yeah? Another scenario is that you can attach it directly to a specialized endotracheal tube which already contains sampling adapter, such as this unit here that was designed by Mindray. And you can attach it to the Y-piece. This way you can sample gas for capnography. Now let's use this airway adapter, which is a 90-degree angle adapter for sampling CO2. So this way you can prepare the machine ready to be used, and maybe the machine is in your way and you wish to push it away against the wall. But be mindful, because this sampling line is standing outwards. If you push it to the wall, it can break the line and actually damage it to cause a leak, and it should be avoided. So be careful and do not push it against any hard surface. Now, no matter what you do, eventually water will enter this line, and this is undesirable but cannot be fully prevented because the exhaled gas is full of moisture, and the moisture may condensate in this line. If it's small droplets, that can be aspirated into the water trap and it's collected in this vessel. Thereby, the capnograph itself is protected from water. However, if larger droplets form in this line, that can completely plug the system and prevent the capnograph from working. If you realize that that happened, you must change the sampling line to a new one which is dry and continue working. Meanwhile, just hang it up and let it dry, and eventually you can use it again. This water tap also has a filter which can become moist, and the moisture will increase the resistance of the filter. So the moisture can completely block the function of this water trap and block the gas flow through it. So for this reason, if that happened, you need to change the water trap. But in order to prolong the life of your water trap, after every use, I recommend you to take it out, empty this, and dry the components like this. So the filter has a chance to dry, and maybe you can use it longer. There are two types of accessories coming with your capnograph: an adult and a pediatric set of water trap and sampling line. The pediatric sampling line, this one here, is narrower and has a smaller volume. Similarly, the pediatric water trap has a smaller volume. The sampling flow rate is automatically set to 120 milliliter per minute for the adult set and to 70 milliliter per minute for the pediatric set. CO2 measurement quality depends on the ratio of sampling gas flow over the volume of the whole system. The smaller volume of the pediatric set will compensate for the lower sampling rate of this system. Many people, including myself, tend to use the pediatric set for every small animal patient regardless of their size, because it works nice, except that the narrowing sampling line of the system is more amenable for clogging with moisture. My name is Dr. Tamás Ambrisko, and I'm a veterinary anesthesiologist. Thank you for watching.